Hi, Kemal.
How are you doing?
Good, how are you?
Good. So, thank you for joining us. So today we are going to discuss HCC, rough scores, and corrective claim process. And you are going to go through the process we follow. This is the part that we use mostly internal education for our employees and also for our clients who may want to get more familiar with the process. So I'll let you run it from here.
Okay. All right, let me know if you are able to see the presentation.
Yes.
Okay. Go ahead and put it into the slideshow. All right, does that look okay?
Yep.
Okay, great. So like you said, we're going to be talking about RAF score and corrected claims. So what exactly does that mean? So HCC is the hierarchical condition category coding and risk adjustment.
It just didn't go to the slideshow. It just stayed on the
I'm sorry?
The
Did it stop sharing? I'm sorry.
Maybe you're not signed in.
Just a quick present.
Huh?
She has to go to the present mode.
Let me see. Is there a present mode rather than slideshow?
Let me see.
So go back to the slideshow again.
Yeah.
It's on top. Up. Like the one before the two next door to the view.
Got it.
Yes. And okay, you can hit from the current slide again.
Yeah, it doesn't look like it's wanting to do it nicely. I'm sorry. Let me try to just share one more time. Just bear with me for one moment here.
Okay.
Yeah, unfortunately, it doesn't look like because I'm on the online version. I'll just share that and I can make it bigger if that's okay.
Okay, that's fine.
All right, so let me get rid of this here. And then I'll go ahead and zoom in a little bit. And are you able to see that okay?
Yes.
Okay, great. So just talking about HCC, RAF scores, and corrected claims. HCC stands for Hierarchical Condition Category Coding and Risk Adjustment Factors. So this has been in existence for quite a long set of time. And HCCs are essentially used by Medicare and insurances to figure out the risk of a patient. There are sets of codes that get assigned a risk factor for a specific patient. So if a patient has no conditions versus if they have multiple conditions such as diabetes, morbid obesity, all of these are going to have a risk factor that the insurance then use to calculate how much that patient is going to cost or how often they would actually cause costs in the hospital. What we do with the RAFs and corrected claims is our care coordination team. So we have a team of nurses that goes in and conducts audits. They audit the charts, they look at all of the diagnoses and see if there is anything more specific that we could potentially add to that claim based off of the note that the doctor had already created. What we do on the revenue cycle team is we actually submit those claims as corrected after the nurse team identifies the errors. So as you can see here, over the last 3 years, we've definitely been doing this for a while now, and we keep increasing the number of audits and the number of corrected claims. So in total, there's been a lot. There's been about 37,000. But you can see that we did 5,000 corrections in 2021. We did 7,000 corrections in 2022. And at this point in 2023, we've almost reached the amount that we did in 2021. So as we continue to do these audits, we're definitely able to identify areas for improvement. I put a little blurb here about the specifics of, do you have hypertension or do you have hypertension with other issues? So it's kind of like, did you get a new car or did you get a specific type of car, like a Tesla? This explains it a little bit better. So this is capturing the risk. You can see that there's a patient here who has diabetic polyneuropathy, morbid obesity, and congestive heart failure. If you combine all of those diagnoses, you get a risk score of 0.427. However, when we look at all of the issues that the patient actually has and make sure that they're coded to the highest level of specificity, we can see that there's a couple more specific things, specifically congestive heart failure. When you add all of these together, you actually get a higher risk score of 1.325. What's important here is that the patient's diagnoses didn't change, but the coding and the documentation of it did. And this lets the insurance know that this patient is actually a higher risk than if we would have just coded it this way with diabetes, hypertension, morbid obesity. When we give in these polyneuropathies and the congestive heart failure and the BMI, it really paints a better picture of the patient's current health. This is an example of what our work would look like. So here we have all of the diagnoses. Originally the provider had billed 6 diagnoses on the claim, but upon review, our nurses identified that F32.0 was able to be billed as well. 2 out of the 6 diagnoses had a RAF score affiliated. And in addition to the 1 new code being added, 1 of the 6 diagnoses was able to be updated. So just by looking at this one patient, we were able to make a significant change in the documentation on these patients' issues. So what does my team do? Like I said, after the nurse team goes in and actually audits this and looks at the diagnoses, we submit a corrected claim to the insurance. So this is not a real patient. This is just a test account for me. But I gave examples of if I had hypertension and kidney care or kidney disease. If you have both of these in conjunction, it actually does change the diagnosis. And so we would go ahead and recode that, and we would submit that as a corrected claim. And just by doing that, we are telling the insurance, hey, this patient has significant issues, and it's not just 2 separate illnesses. It's something that actually causes a higher impact. So how do we optimize this? We all work together as a team. We have a solid understanding of the HCC ownership at all levels. We make sure that the appropriate diagnosis coding is at the highest level of specificity. So again, do they have diabetes or do they have diabetes with polyneuropathy or anything else? We want to make sure that the clinical documentation supports that. That really is the most important thing, to make sure that our notes are reflecting the accurate diagnosis for the patient. Effective data management and effective flow management. So we work all together to make sure that that goes into effect. And what does that actually mean? What does that translate to? So really, when we are reporting the correct risk score, we're improving the patient care because we're accurately reporting their issues. It leads to increased revenue and increased staff satisfaction. So taking a look here, we have 2 different groups. Group 1, where that risk score was less than 1.2, and here where it's between 1.2 and 1.5. Based off of that risk score, you can see how much the insurance is really investing in these patients, that they really are going to end up probably going to the doctor more often or potentially using emergency services more often. So the insurances do recognize that when we're accurately describing the risk of the patient, it does translate into more population-based care. And that was my last slide. I can stop sharing. Any questions?
Well, Katie, thank you so much. So now, what you presented for us today is one of the ways to see how a medical billing company can evolve from a medical billing company to an advanced RCM, revenue cycle management company. So in today's medical practices, especially private practices, which our client demographic is, what we understand is compensation model is not going to stay the same. Compensation used to be for medical offices based on fee-for-service. So you would see X number of patients, you would build certain level of codes, and then that's how you would get paid. Today, almost 20% of our income, our compensation is depending on value-based contracts. United Medical ACO has almost 8 different ones with different insurance companies. And in order for us to not to get a pay cut for our clients, we have to max out this 20% today. So what I also see in the future is the 80-20 distribution probably is going to be getting a little bit heavier on the value-based side, because now there are dual risk contracts where practices are taking risk. If there are any loss, then they will be liable. So that makes it, that emphasize the quality and value even more for the future. So that's why for us, from the medical account receivable standpoint, and from the offices who are entering charts, from the physicians who are entering initial charges, and what diagnosis we use, how we use it, when how frequently we use. This all becomes a big part of how we get paid today. So what United Medical build for our clients is from the central office, several nurses who are on the clinical side trained to do the writing. They actually do the chart reviews, and this process started with the help of revenue cycle management side. So now we don't want to lose, we don't want our clients to lose any income for the program year. So, and I believe it's working so far. So this started in late 18, early 19. You know, one of the challenges that we all know, we all see is, for example, Medicare, their risk score follows about 2 years behind. So what we have done 2 years ago is going to reflect today. What we have done last week is not going to reflect until 2 years from now. So when you have to work in different dimensions, time-wise, then you don't actually see and you don't kind of connect these benefits right away. But the big issue, and I believe what we do as an accountable care organization, as an RCM company, we are closing that gap and then trying to maximize the income, the revenue our clients can generate. So, and your examples were very nice for our employees to understand. But also, if someone out there who has a medical private practice, some doctor with 3 other partners, and they didn't know about it, chances are they don't know about it. So then they are losing 20% today. So I also want those individuals to watch these events and understand better how they get paid. Your compensation model is changing, and that's why you have to adapt and you have to have good service companies in place to help you to maximize your compensation. So Katie, again, thank you so much for joining us, and I'm sure we'll have you again in the next couple of months. It's always more fun when I have you guys joining, and also now I'm also learning from you guys these days, so that's even better. That makes it even more enjoyable. Thank you so much again.
Thanks. Have a good day.
All right, so we are gonna have Sean joining us. So Sean, you are actually part of this corrective claim process, but you are from almost every different angle of where it starts and what we do in the case conferences, and then you have a first-hand experience how this is affecting our clients, right?
Yeah, definitely. You know, as we're doing these case conference reviews, we're trying to paint the most accurate picture of our patient in real time, and obviously, as you know, it's kind of challenging to try to keep everything up to date, you know, as immediate as possible. But part of what we do is to try to get the most accurate picture. And the way we do that is kind of breaking down analyzing, reviewing their charts, making sure the proper diagnosis codes are added and that they're being captured in the fullest, most accurate picture possible. And as you're saying on the back end, then that's going to paint the picture for the outcome revenue wise when you have the accurate risk score and how it's going to relate with our insurance companies. And it is a tedious process, but it's definitely a necessary one if you want to have
That's loss can be pretty big, right?
Yeah, definitely.
So no, this was good, and Katie did a really good job covering these. So now we are going to talk about one of the AMA, American Medical Association's decision or recommendation on BMI and how BMI is being utilized.
Yeah.
So use of BMI alone is an imperfect clinical measure, and this is the new AMA opinion at this point.
Right.
So although BMI is a very easy one and very inexpensive one to use, at least set the benchmark, but it's not the most efficient way or by itself. So we are not saying that the BMI is not the right one. We are saying that by itself it's not the most accurate
As a
one.
standalone, correct.
Right.
Yeah, so this is kind of piggybacking on what we were talking about right there with Katie and her presentation about the accurate risk score. And as you know, BMI is that height to weight ratio and pretty quick, easily calculated, automatically goes in our software for us. But just having that, we always use this term, the cookie cutter approach. Not everyone's body is made up the same way. So if you think about if you have an athlete, like a football player, power lifter, their BMI may suggest that they are overweight. But when you're realizing that the muscle weighing more, that really they are indeed healthy for their body, but that calculation doesn't know that they're an athlete. So it may say, hey, this person's overweight, or they're almost obese if they're, say, a 6'7", 320-pound lineman who that's basically all muscle, these bigger people, but they're being an athletic build versus the BMI might just say, oh, it thinks that's all fat calculated in. So it's not necessarily the best thing to rely on solely as a standalone, as we're saying here. So does it help? Definitely. Does it help?
I mean, it's for
the
base. It's a good
starting
measure.
point.
Because if someone's this bodybuilder with BMI 40, that's still accurate.
Right.
So, but you are maybe talking about someone BMI with those bodybuilders, maybe they are 29, 30.
Yeah, so it doesn't know their lifestyle.
Like right now, for example, and I'll just make this a little bit personal. So I added maybe 20, 25 pounds in the last 2.5 years. So without losing any, by just working out, keeping my weight, I can slim down, but then my weight will be same. So then my BMI won't change. So
correct.
Hopefully this will motivate me to do that. So, but that will, right? So that really won't apply to those people. But there is this BMI between 30 and 35 these days, especially when you look at where the fat actually is, like how the body shape is,
where they're holding it,
what their gender is. So like female versus male, there's a difference. And then their ethnicity. It's like there's a new, and actually maybe it's new to me, but I was at the bariatric conference with ASMBS this past week with Dr. Erkan, and we have seen there's a new BMI, I believe, is ratio for Asians. So
I didn't know that.
Yeah, this is new. So that means it's not for everyone at the same level.
Yeah.
Again, we don't want to take away the this is still the right way to start and have set the baseline.
Yeah.
So, but then how, if someone is from obese, if they have obesity versus if they have morbid obesity, that's not going to be just solely on BMI. So we actually practice that a little bit on those patients with 35 to 39 BMI, if they have one of those 4 diseases like comorbidities. illnesses for those who are watching and not familiar with the clinical term. So those patients who may have cardiac disease, hypertension, diabetes, and sleep apnea, they would still qualify. I say qualify for bariatric surgery, but they would be diagnosed as morbidly obese. So someone whose BMI is 37 and they don't have any of these, they would be under labeled or diagnosed as obesity. But if they have sleep apnea, then it would be a morbidly obese diagnosis that would be used.
Correct.
So this is important because this is going to help our maybe medical professionals to better understand. Okay, so if I see a patient, I'm not just going to go by the BMI, but I'm going to actually examine them a little bit better. I would check the lab work. I would check the other measure that's available to me, so that I can actually make that decision. Like for example, Sean, like what happens in our bariatric program, we do start with the home sleep test for sleep apnea. So, but what we see in the primary care setting only, if the patient is not going to go for bariatric surgery, they may not want to do that, as most of the time the obesity is not being treated until patient starts complaining about it.
Yeah, once they see other side effects. Yes, until the obesity leads to something else now not working, or getting pain or some other complication, then it's like, oh, well, let's see, what's that comorbidity? Oh, common ground. The obesity is kind of contributing factor to all these other issues. So I see what you're saying there. And that does, as you're saying, with the BMI impact, where somebody who may have, at least in the example I was using, where overweight, that's a different category as opposed to that threshold between obese and morbidly obese. That's a different threshold BMI wise. Whereas somebody who's healthy weight versus overweight, then you'll see dive into their lifestyle. Oh, they work out a lot. They have more muscle mass, as opposed to somebody who's on the fringe of morbidly obese versus just obesity. So
I mean, again, I see this as a very positive news for the medical community, because now understanding obesity and morbid obesity is being emphasized by this, so that you are not just looking at one measures. And then what they say is that to actually, like the other thing, that understanding the eating disorder, for example, like patients may be on the obesity side, but they're not morbidly obese, but they're eating disorder. So like many people understand eating disorder as like anyone who's morbidly obese, they think that they have eating disorder. That's not the case. Eating disorder is motivated with different reasons, and it's a contributor to the morbid obesity, but it's not the reason for morbid obesity. Someone may be trying to harm them by eating too much, just like the other way of anorexia. Someone have eating disorder by bulimia, right? So like what Princess Diana had. So they will throw up every meal that they have. That's also eating disorder. So the eating disorder is also an important factor here, and then that's why they are saying that we need to take this education to even earlier level of our life with the school nurses, coaches, trainers, teachers, so that they can actually observe abnormal eating behaviors, dieting, and weight restrictive behaviors in children. So that's the only way that we can actually get more information or better information. So that's one of the best way to actually start better understanding this utilization of nutritionists. United Medical ACO has 4 nutritionists. We utilize them for both for our diabetes program and also for our bariatric program. And when people feel like they're challenged, they can easily go to one of these professions and get better help. So that's one of those things that we want to make sure that we cover for everyone.
Yeah, definitely. Especially, I think it's beneficial to people who really want to try a new diet and something that they heard about in the workplace or they read online and they're unsure of the best way. Because I know a lot of people, I even heard experiences back where they'll try like a new diet, like a keto diet, for example, and sometimes they may overlook where they used to be getting certain nutrients that now when they start this specific diet, they're no longer getting that. And without taking like a supplement or maybe like a pill or something, certain diets can impact the body in a negative way where all of a sudden you're not getting this mineral or nutrient you're used to getting. So even just consulting with dietitians, nutritionists on that aspect, or even if you have a certain goal, whether you are at a healthy weight and want to get to, I'm training for this type of triathlon or something, I want to know what's the best diet regimen to put myself on. There's other benefits. It's not just, oh, if you have an eating disorder, you should go see them. But, you know, there's other people who can also benefit from seeing our dietitians, nutritionists in that sense.
Absolutely. So now we have other topics that we're going to bring up.
We do.
So let's see.
Mm-hmm. We have an array of couple random ones do relate to our economy, the U.S., what's going on there, our government, some policies going on, also some headlines specific to the state of Delaware, actually just recently coming out, impacting Sussex County down there. So we do have an array, but we will kind of get to those one by one. So I'm not sure where you want to start, but we can dive in wherever.
So, well, the timing of me starting the video is a little bit late. I apologize for that, but we'll get better. So here's what I would like to say. We live in a very interesting time. So as I was thinking that we were becoming more and more liberal society-wise, how things are being forced on us. And I think maybe it started with Leah Thomas from UPenn. So then like being forced to not accept but celebrate and participate, right? So from that to like all of a sudden we got hit by, at least from my personal side, maybe you may not agree on this one, we get hit by the Supreme Court decision on affirmative action. So in my opinion, and I'm a business owner, people have to really watch this with common sense. I don't want people to just take one thing and then just not listen to the rest of it. But what I believe, we are all racist. But in this way, so the whites are racist, the blacks are racist, Asians are racist, Jews are racist, and the royal family is the most racist. Racist in a way that it's not racist against one to the other, just one specific one. Like it's not like racist to blacks only or racist to Asians only. We are all racist in our own societies. So Asians are very racist. So Asian parents wouldn't want to have white, like if their daughters to get married with a white guy, or with the Jewish family wouldn't want to have a Muslim bride. So then the black family doesn't want to have a white bride. So that becomes a big issue. We all know this. Now, people don't talk about this, but when you look at it, every society, every background, every ethnicity, like all these have its own norms to be racist. Now, that's given, right? So that's given in a way that that's part of who we are, today's society, or in the past or in the future. But what we have to do is the right thing for. This is where I become more Democrat. So if the social issues were not a problem for me, so I would be a hardcore Republican. So please don't kick me out of any of my finance committees if they are watching it from the Democrat side. But the social issues are extremely important. And this is where I believe we still have to worry about certain things. Now, what is affirmative action? This is something started in 1965. And then Harvard and University of North Carolina, they were the first ones from the college's standpoint. They adopted this in 1978. But then there's a case brought by Edward Bloom, conservative activist. And now Supreme Court made the decision. This has been an ongoing case, but no one was expecting this outcome, most likely. So now, what is the problem here, right? So, and who actually really benefits from it? I think with the positive, this is like a positive discrimination, right? It's almost it's necessary. I've been kind of debating myself, like, like, is this the right way, the wrong way, why? But there's a lot of background on this.
Mm-hmm.
This is not just something happened today or 10 years ago. This is a long history of what has been happening, and this is a way of repairing what has been happening. Not everyone is born with same means. We don't have the same privileges. We start ahead of the game in some cases, and then we are way behind in some of the cases. Environment makes us less educated in some cases. If you are in the east side of Wilmington train station and live in that neighborhood, chances are your kids will be in jail by age 15. But same town on the west side, 2 miles from the city limits, you have one of the best private schools in the United States, and those kids won't be in jail by the age 15. So they don't start at the same level.
Mm-hmm.
They are not. They don't have the same equal rights. There are privileges that comes with, and I think for society to be, in my opinion, more peaceful and more organic, you have to take care of these types of issues. And I don't believe we are there yet to do this without a good law in place. But if we are saying that now that this is just based on the SAT scores, I mean, we know most Ivy League schools, they just get their own, like, whoever is graduated, if your father or your mom is from there, your chance of getting in there is easier, right? That's what the Ivy League is.
For a legacy,
Yeah. So, well, what's wrong with the guy who works so hard but don't have the same trainers or same tutors and same all the other resources that you may have or I may have, but then they are just doing it on their own? That person is part of the society. I'm not saying that everyone has to be equal, but the equal opportunity needs to be given. Sometimes for equal opportunity, the base needs to be set. Not everyone's base is the same foundation. So I believe that was a mistake. And I'm worried that it's going to actually bring up more issues in terms of the society itself. And I do believe also that maybe institutions like the universities can actually handle this maybe without the law being there. But now that's becoming illegal, so that's the problem. So now there almost be the right that's being given is now taken away. So we don't also trust the institution anymore.
Mm-hmm.
So I know you may be a little bit different on this, but go ahead.
Yeah. So I mean, my take on that. I think the example that prompted this was there was an Asian American student who had a nearly perfect SAT score and he was rejected. And I think it was due to, like you're saying, the race card on, they need to fill so many seats for each background diversity to satisfy that they are well represented. And I think the argument there was if somebody has a better score just because they're of race X, that's somebody who performed well. I'm not saying this is solely, obviously the admission process at universities isn't solely on a test score alone, SAT, ACT. There's a lot more to an application. Even a lot of universities are test optional now, so you don't have to submit your scores. But let me ask you, if you don't have to tell me that, and we didn't really talk about it, so I don't want to put you on the spot. What was your test score, the SAT? Well, I did my ACT 30. Like that out of? It's out of 36. So that was kind of high. Like, give me from the 1500 one. That's is it 1600 the best score? I think, yeah. So they moved from like a 3-part to a 2-part. I think right around when I was. So I want to say I was like a 12, 20 maybe on the 2-part.
Oh, funny.
I was
Okay,
like
so
16, yeah.
I mean, it's high, but not high enough.
It's above average, but it's not like a
So
remarkable.
I can tell you, I would still hire you if there was someone who has full, like the full SAT score,
Perfect. Yeah.
versus perfect SAT score. I would still hire you over that person if the only criteria is that person was that person's test score. I would not. Because the personality is important, right? So the what you bring to the table is important. How you interact with the others is important. How you understand the business is important. So if I look at it from the employer standpoint, so the test score, that Asian guy, I don't know who he is, but just because he has the best test score doesn't mean that he's going to be the best for that that spot. Because what you bring to the school's variety, diversity is important. Like if you look at our leadership at United Medical, there are 6 of us, I believe, including myself, all different individuals. Someone may just think that, oh, they're going to be all like Kemal. No, they're all different personalities because they all bring something different to the table. So I wasn't looking for another superstar there. I was looking for the person who can bring the most for the position that they are in. So that's why I don't believe that SAT can be the only score.
Yeah, it's not a standalone.
But also, like what schools are doing for us, like universities are doing for us, even the other schools, high schools and middle schools, elementary, these institutions, they prepare us for the real world. So if I'm in a pre-selected, isolated group of people that I have to go to school with, then how am I prepare for life anyway?
Yeah.
So now, if there's 0 Black kids in your school, how are you going to work in the real life scenarios? How are you going to adapt to that? School's supposed to be bringing all these different backgrounds, different diversity, having good diversity, bringing different ethnicities into one proportionately. I'm not saying that Harvard needs to be 7% Black or 80% Asian, but it needs to reflect the society. Now, if I'm not mistaken, and you can fact check this later on, even for white kids, where they are coming from, they benefit from the affirmative action because with the same conditions, same scores, someone from Nebraska versus someone from Philadelphia, the Nebraska guy has a higher chance of getting into one of these schools because they want that background to be reflected in their school versus the person in Philly, they may have another 20 others that may be already done there. So even the Caucasians are benefiting from it. So, I mean, yes, it needs to be looked into it carefully, but at the same time, the social peace is important, being peaceful in society. Like, this is why welfare is important. I'm not saying that people should be on welfare regardless, or it shouldn't be encouraged. But if the resources are not there, then we have to bring up the standards of those. So then, like what we were discussing in our last couple of sessions is people who are homeless, people who are in shelters, people who live under poverty level. So this is part of it. So if you have too many inconsistent or maybe consistent way of pushing people away from the rest, I think that's gonna be a threat to the future of social peace, in my opinion.
So I have a follow-up question for you then. Where you're saying how you want to have them in an environment that's going to prepare them for the real world. So you're saying like if it was an all-white, you wouldn't say, you're saying like it'd be 70% Black representation at Harvard, for example, but you want to be exposed to people of different backgrounds, vice versa. So what is your stance on like an HBCU where it's like, would you recommend, so say if someone who's Black, should they then pursue a university that's an HBCU where they're like 95% also Black, or would
No,
you recommend
I'm saying
them
like my
to?
position is same. So I don't think there should be all Black college either. So because that's not the way of preparing people for real world. So like I think the other the one that I sent you today, so we are going to invite him. What was the name? Haan or Todd?
I think it was Tony.
Tony.
Yeah, he's Delaware State, but they are one of the HBCUs.
Yeah, so then you know, we'll send the invite and then maybe he can join us. I don't actually agree with. I mean, I don't know the dynamics of that, how they become so heavy on the on one race, but I don't think that's healthy either.
Yeah, I mean, it's basis that historically Black college university, but that's, yeah, they do. But obviously, it's a benefit if you're.
But how many of those versus how many of the others? So like, it's all about the proportion.
Right.
So if, you know, this kind of goes into other issues, right? So there are, I think 2.5 times more from the proportion standpoint, more Blacks in jail than the population they represent. So chance of someone going to jail is almost 3 times. So then if you look at the prison population, it's almost 7% Black. I may be off with the numbers. I do have number disorder. I apologize for that. But 65 to 75 is not going to make much difference. The majority is what I'm referring to. And if you have that problem, that also speaks for itself. So, like, because of my own background, when I am in certain situations, I don't feel comfortable just coming out and saying who I am to some people. I'm talking about like, so if I'm in a place where I feel like, well, okay, so the shooting range, how racist they were towards me it's consistent. So just because from my name they associate me for Middle East, and then they try to tell me that this is United States. Well, I pay 50 times more taxes than that lady who insulted me, and she'll never pay what I paid in her lifetime. But she sees herself entitled for what she was telling us, and you were a witness that day, right? So that is, you know, that's still happening. If I feel at this level, this way, just think about some minority kid, age 12, 13, 14, what they go through. Now, either in Obama's or Bill Clinton's book, one of them, and I have to go back and check at some point, but I think it was Clinton's book, where what he talks about is, I think when he was teaching, you see that by the time they are 3rd, 4th, 5th grade, the Black kids, they lose their hope. And then he was saying that I can tell from their eye, okay, that they lose hope because their environment is not promising. And environment is created by us, by everyone, not just them. So that's why our government has to do the right thing. This is where I believe Republicans can pick up a little bit more and understand the society. This is, I mean, you know, again, like we always talk about, like this is that fine line. You cannot have those issues and then just worry about the financial part of everything, because there is that social justice, social peacefulness is important. So what's happening in France these days, right? That one kid, one 17-year-old was killed. Now the entire country is burning. Why? Because they don't believe that that's right. That's the right justice. So that's, I mean, I don't want to lose the focus on this affirmative action. On one hand, I was like a little bit not happy, but kind of like it was a balanced feeling of, okay, maybe it's not really so crazy liberal that we are going, because I think on the trans issues, we are out of control. So because the kids are getting hormone therapy is horrible, and the law is trying to protect those individuals is so evil. And I thought that's the direction that we were going. And then this was kind of like a reminder from 1965. So there has to be a better balance. There has to be a better understanding of what society probably wants. And then there's a more middle ground for all this. It doesn't have to be one extreme, but it has to be reflecting what our society has today. Like you and I, we are in this organization. We may have different opinions, but we are able to work together for the same goal.
Mm-hmm.
So, I mean, it doesn't have to be that way, right? If we don't create this environment, if United Medical doesn't provide this, where we have so many employees from so many different backgrounds, men and women in this office, we have more female than male employees, I believe. In our leadership, it's 50-50, 3 female and 3 male. So we reflect, and sometimes positive discrimination, positive, what's the other from that discrimination that I'm lacking now? The positive, selective.
Well, but affirmative action is positive discrimination.
Yeah, but I mean, we have positive discrimination against women because I want that to be taken care of. At least that's my contribution to the society.
Mm-hmm.
So if my company, not only just for the entry level, not only just for the mid-level, if I'm at the leadership, I'm at 50-50, that's a good way to look at everything else in other organizations. Mm-hmm. There has to be there has to be a more reasonable approach from the government standpoint. Hopefully, this won't go out of control, but that's where we are on that issue. All right. So what else would you like to cover? So I know we spent a little bit more time, but because this all came at the last minute, so.
Yeah. Well, I don't know if you want to hit on the Delaware, the Sussex County ruling, or we also have the Supreme Court, the ruling on canceling that student loan relief that Biden was pushing for. The decision that had to be made by the end of June. So they had that released just recently, and that's basically saying that I think it was like $10,000 for everyone that had debt, and then it could be up to $20,000 if you're on like Pell Grants. But that was then shot down by the Supreme Court, so there's no student loan forgiveness. But in the article, they said that he would be pushing for a similar, I guess, bill or approach to still try to get that relief of some sort. But I know the one part of the article said that's going to draw away because that was kind of his driving force for the younger voters. Mm-hmm. So that's the bulk of who has the majority of student debt. Obviously, there's those in grad programs and doctorates, but as you keep paying off as you get older, so the people that have the highest amount are younger.
Now, there's also something happening in Delaware. So you and I, we tried to reach out to the Delaware Democrats, and we were not successful. So here's what happened. So when we want to invite someone to the show, did I say Democrats? That's the Republicans. So when we reach out to someone on the Democrat side, we get a response right away. Now, I don't send those emails. Sean usually initiates those, and they don't know that that's coming from me directly. They don't know him, but they respond right away. Mm-hmm. Almost no exception. So, well, the Republican in this state is a different story. So you and I, we were talking about it, and I thought they were just being so ineffective, inefficient, just so that because they can win. But then this news with the 1.4 billion bond bill, mm-hmm. And how they're able to actually lock that, at least for the time being, that was kind of surprising. If they have that kind of power, why would they not want to be more visible and more responsive when they are receiving invitations for these types of shows? Mm-hmm. We had from every level, from the state officials up to the governor, we hosted them here. So you would think that this would be a good place for them to be more visible, but now they are able to block this and then create a little, local government crisis but they're not actually representing their voters in an efficient way. So it's kind of surprising that that's still happening.
Yeah. Well, now we have some more names, at least the reference in the article, so we'll be reaching out again.
So, Sean, I know we invited, there are some conformants for our for the election period, I guess, that for 2024. So we want to have all candidates being able to come to this show and then address issues, and we want to be able to ask them questions. So the confirmed ones on 7/14 is the first one.
So I believe it's 7/21 was Colleen Davis, the treasurer.
And she's running for the treasurer.
Yeah,
Okay.
so she's current state treasurer right now. And then you also had August 4th was
Matt Myers.
Matt Myers, yep. And then a little bit later in August, we also had running for state insurance commissioner, Coyote Abdullah, I believe his name is.
Yeah.
And then there's still a couple other that are pending. They're looking for confirmation. So another end of July date, beginning of August, you do still have those 2 slots. So
I think Davis is going to run for the. I think she's going to challenge Sarah, right? I may be wrong, but I'm just going to double check right now.
Yeah,
so Eugene Young is one of the people who is going to most likely. Eugene Young is one of the people that may challenge Sarah, and also one more person. Yeah, Colleen Davis may be running for Congress. So there may be 3 people. So it's not going to be an easy run for anyone. So. But then we invited the mayor of Wilmington. We should be able to get him soon. Matt Myers, we did say, and there will be some others who are going to join, but these are already confirmed ones.
Yeah.
So that almost twice a month, those guys should be able to join us. Well, again, we have our Geriatric Friday in 5 minutes. Dr. Erkan is going to join us. And this is an important weekend, a couple days from now. It's going to be the 4th of July. Well, happy 4th. Have a safe vacation holiday week, just because we also close the office on Monday. So there's 4 days that our employees and their families are able to enjoy. Happy 4th and be safe.